I'm Brian Yarnell, President and co-founder at Bluestream Health. Let's take a closer look at what makes the Bluestream platform special. Bluestream is a platform as a service for virtual care. Telehealth is basic one-to-one video. Integrate that into an EMR, and now you've got things like scheduling and reporting. But by and large, we're still talking about a single connection between a patient and a provider. Fast forward to COVID-19 and value-based care delivery, and we're talking about virtual care, brick and mortar types of workflows that are presented outside the hospital. Once you put those workflows in place across the health system, and importantly in front of consumers wherever they are, now we're talking about virtual first healthcare. And what really sets this apart from telehealth is the fact that it's on demand. Patients can get into sessions whenever they like, wherever they like. Key elements of getting into on-demand care delivery are front doors. You've got to make this available to patients through a number of modalities, whether they're high-tech, low-tech, or directly integrated into existing systems. A layer of intelligent triage and escalation, getting folks involved in the care delivery, the tools they need to treat patients and transition patients appropriately to clinical providers. And then make clinical providers' lives easy with the ability to segment delivery into queues, automate care delivery where appropriate, and provide situational awareness so you can see all of the different events happening across the system. Layer in some intelligent automation, and now you've got a platform that can engage patients anywhere, anytime, and make it cost-effective to deliver that on-demand care. Let's take a look at an actual customer example. New York City Health and Hospitals has dozens of digital front doors. These are presented to patients through consumer-facing websites, through integrations with partners like insurance companies, in the patient's native language wherever possible, through direct integration into ET3 and first responder program, into Epic and other systems across the health system, and even into traditional telephone and 911 systems. All of these different pathways are automatically routed and escalated through Bluestream to a group of triage agents that 24/7 work to get patients in front of clinicians as fast as possible. Let's take a look at what some of these tools look like. Here's an example of a branded integration between New York City Health and Hospitals and Metro Plus, an insurance company. Directly on Metro Plus's website, we can hit Talk to a Doctor Now, and we're into Bluestream. You'll see that we've got gating technology on our Care Navigator platform. So once we specify that we are in fact in New York State, pick a visit type and consent, we're given the opportunity to validate with a Metro Plus ID. In this case, we're hitting the insurance provider's API directly, and we'll validate this as a member before allowing this patient to go through to a visit. Here's another consumer-facing example, this time on New York City Health and Hospital's own website. When I click Talk to a Doctor Now, because I've visited the health system in the past and identified as a Spanish speaker, that's the language I see this information in. You'll notice that our Care Navigator platform has adapted the intake form into Spanish and also has additional data collection, because in this case, we're coming in through a front door that is not the insurance company, so we need to identify ourselves. Once I go ahead and click Connect here, we're going to be connected directly to a doctor. One more quick example of a front door. This time, I'm going to invite a patient in through a text message. You'll see this pop up on my mobile phone, and when I get that message, I can go ahead and click into the visit, and I'll be directly connected with the physician that invited me in. You'll see we have Care Navigator mobile optimized as well, and the options here adjust automatically. Agents at New York City Health and Hospital monitor a queue in real time and can see calls coming in from all sources, sorted by priority and wait time. When an agent wants to interact with the patient, simply click the video button and we're connected to the patient. Once the patient's connected, we have access to a suite of tools, including updating patient information, entering the patient into the health system, and doing important tasks like bringing in interpreters. In this example, I'll bring in a sign language interpreter to help me interact with the patient. All right, thank you. The agent can also transfer the patient off to another queue. In this example, I might want to send the patient off to a queue with a clinician and go deal with the next patient. I can simply click the information I want to send through, send this patient off to someone like a triage nurse, and this patient will be sent into that next queue, and I can go ahead and continue dealing with the next patient in my queue. At the conclusion of the call, the patient's presented with a configurable survey, in this case, a Net Promoter Score. We've also got options to reconnect if necessary. The example you just saw from New York City Health and Hospitals is just one example of the type of solution you can build out with Bluestream. Bluestream has an entire suite of tools to design, deploy, and manage virtual care across the care continuum. Thanks for listening. If you'd like additional information, please visit our website or send us an email.